listening to On the Way Home with your host, Michael Braithwaite.
Welcome, Housers, to another episode of On the Way Home. You'll notice I'm not here on my own today. We're co-hosting this episode with Blue Door's new CEO, Emmy Kelly. I'm moving on to different pastures. They say greener, but man, is the grass always greener? You never know, right? So different pastures shortly. And Emmy, who you're going to love, is going to take over the show. So today we work together on this episode, and it's awesome. We're going to tell you more about that later. Before we get to that, Emmy, what's going on at Blue Door?
Lots, but we're pretty pumped because Blue Door just graduated its first all-women cohort last month, which is a real milestone in our mission to expand opportunities for women in the skilled trades. As you know, the Construct program has been going on for a while. This year we have 270 participants slated, and the idea behind Construct is the wraparound supports that allow you to move on to a great career and stable housing. So this cohort, focused on women with more to come this year, offers additional supports through childcare, transitions into employment, transportation, to help women enter a sector facing a projected shortfall of over 350,000 workers by 2033. So we're pretty excited about this. There's lots more to do, but it's a great achievement this month.
Very, very cool. And as you said, tons happening at Blue Door. And if you want to find out more about that, folks, Emmy and some of the participants were on CBC just recently. So I'm sure if you just Google that up, you'll see a great segment that they did talking all about that amazing work. And you can find out more, of course, all the different things happening at bluedoor.ca. Hey, maybe you want to be a partner with Blue Door in something. You've got an idea you want to work with us on. Maybe you have an idea for this podcast. You have a guest idea. You want to reach out to us. So reach out to Emmy at emmy.k@bluedoor.ca. If you have an idea for a guest, you want to be a guest, you have thoughts or feedback on the podcast, for sure, we would love to hear from you. Of course, we want to get to today's guest. So Emmy, why don't you tell us a little bit about today's guest?
So today we're speaking with Ross Perry, who's president of CHX Technologies. It's interesting to learn a bit more about Ross's work. He has advanced a preventative oral cure, I guess, or solution, which he is very interested in advancing for our very most vulnerable populations as well. It's essentially a preventative treatment that you paint on your teeth, avoiding all sorts of other dental care. I think what's really interesting too is that they're doing a lot of work to see how this can be advanced to benefit the nation. They've piloted some of it in Europe as well, and we have the opportunity to embrace it here. And I think that it could be a solution too for the people that we serve, and a broader preventative measure that results in cost savings across the healthcare sector.
Yeah, I mean, from what I heard from Ross, listen, changes lives, saves lives, takes away the pain and fear of going to the dentist. And he brought up something too, just like some kind of loose studies, just saying that it could save billions, right, moving forward. In that, as most preventative things do, not only do they make change, but they're super cost effective. You put it into play, and it's very scalable. This is something that you don't have to be a dentist, that a hygienist or others can actually apply really quickly, right? So it's super scalable across our country and around the world, and especially affordable for our most vulnerable. So it's super exciting. It was a great conversation. You and him had great dialogue. I was just sitting back listening to a lot of it, just taking it in as I usually do. So without further ado, let's go to that conversation now. Ross, thanks so much for joining us on the podcast today. Emmy and I are pumped that you are here. We ask everyone the same question because it's very personal and meaningful to each individual. And that is, what does home mean to you?
Well, it's a pleasure to be here, Emmy and Michael. Home for me is a little different probably than most. I live on a small farm in rural Ontario, just north of Cobourg. in the Northumberland Hills. And so home for me means nature and beauty. And I do a lot of walking through the property and through the hills of Northumberland. It's a refuge. It's a way for me to regenerate and refresh. And I'm very fortunate in living where I do.
I love that answer, and I'm actually interested because you referenced the outdoors and nature. I love that too. Um, where do you think the line's drawn? Because many people that are homeless are out in nature and the outdoors. Where do you think the line's drawn for home?
Well, I mean, as I said, I'm very fortunate, but I'm also very aware about the near homeless and the homeless. Our group is doing or is attempting to do some really pivotal work and pioneering work with the homeless and the near homeless and those in transition housing. And so we're very cognizant of how fortunate we are and how unfortunate many people in our community are and how we can help.
So, why don't you tell us a little bit about CHX Technologies? What is it and what is it all about?
Well, we're a new model of oral health care. Um, I'll start with where the whole project began at the University of Toronto about 30 years ago, where there was a discovery made that by treating a certain bacteria in the mouth, they could prevent dental decay. And we've taken that technology over the past 25 years, modified it, put it into practice, began to do the heavy lifting in controlled studies for Health Canada, the European agencies, and the FDA. And so, where we find ourselves today, Emmy, is we have a medication that's applied by a hygienist um, very quickly, topically, without any pain, about 10 minutes. And what it does is it treats the harmful bacteria in the dental plaque. Those harmful bacteria cause cavities and they also cause inflammation or gum disease in the mouth. And so we're in the point now of demonstrating this to various parts of the community as a way of getting people to look after their mouth a little better, helping them maintain their teeth and their dentition and healthy gums. And we are commercializing it as we speak in Europe as well. So we're a Canadian company based in Toronto doing studies and commercialization of this medication, both in Europe and in
And
Canada.
when I read a little bit about your work ahead of the podcast, I saw that you literally just have to paint Prevora on the teeth. Like, how often do you have to
Yeah,
reapply that?
it depends on the patient. We're all a little different when it comes to our oral health, but typically a patient who's at high risk would require in the first year of treatment 4 to 5 applications of this. And then subsequently, once indeed the infection levels are subdued in the mouth, probably 2 treatments over the course of the following year and year thereafter. Some patients don't require any further treatment after the first 6 months. Other patients require an ongoing treatment over the course of their lifetime.
So, when we think about our very most vulnerable and the solution of Prevora, could you tell us a little more about how you see it helping vulnerable populations in need of oral health care and how they might be able to access this?
Yeah, okay. That's a really, really key point for us. Vulnerable people have poor oral health. It's almost a given that if you have low income, if you have transient housing, if you have transient lifestyles, if you have a poor diet, or you have a multiple chronic disorders such as diabetes, hypertension, Parkinson's, etc., that you're going to have problems in your mouth. Vulnerable people have even greater problems in their mouth. For example, the homeless have 3 to 4 times the amount of dental decay as a a patient who has a good home, they have 4 or 5 times more inflammation in their mouth as a patient who might go to the dentist regularly. And the reason why they have such poor oral health is they can't afford to go to the dentist, but the primary reason is fear and anxiety. People of any income, there's 1 in 3 adults who can't go to the dentist because they fear the needle and the discomfort of treatment, or they fear the cost of recurring treatment, or they fear simply sitting in a dental chair for longer than 10 minutes. For example, people with mental health disorders. If you have 10 people with mental health disorders, only 3 will be able to sit in a dental chair for any length of time. So fear and anxiety is a serious problem. Knowing a dentist. Most people who are vulnerable don't have a friendly dentist, haven't gone to a dentist for a long period of time, and frankly have difficulty getting to and from the dentist. And here I'm speaking, for example, about our seniors. Getting to and from the dentist and fear and anxiety are the first and second most important barriers to entry. And the third would be cost. And vulnerable people have exceptionally poor oral health and therefore have exceptionally poor nutrition because they can't chew the food properly, have exceptionally high risk of unstable diabetes and hypertension, both of which are linked to poor oral health. They also have cognitive problems, dementias, mild cognitive impairment. All these cognitive issues are directly related to infections in the mouth. So if you have an inability to get to the dentist, if you are not treated for these infections in your dental plaque, you are extremely vulnerable for not only poor oral health, but also for poor general health.
Ross, what has it sounds amazing, and it sounds like this could be really impactful. What has the response been so far?
Well, it's an interesting question. In Europe, in the UK, there's been a significant positive response to this. The reason being, in the UK, with the collapse of the National Health Service, most of the population is paying for its dental services out of pocket. And when you pay for something out of pocket, prevention has a much bigger meaning to you than if indeed you go to the dentist and your employer is paying for it. So in the UK, there is a significant positive response to this. And in Canada, because we have employer-sponsored dental plans, and we have now the Canada National Dental Care Plan, these dental plans pay for cavity filling, they pay for scraping of gums, they pay for restorative procedures that you and I both know all too well when you go to the dentist. And so the patient is paying little, doesn't really want to be bothered with understanding what the problem is. However, increasingly, with the aging demographic, for example, more and more people are now paying for their dental services out of pocket. And those are the people that are driving the change. They're the ones that don't want to have recurrent decay, a repeat reconstruction of their crowns, don't want to have bleeding on their toothbrush in the morning. And those are the ones that are becoming aware that if you have blood on your toothbrush in the morning, you should be concerned about atherosclerosis. You should be concerned about your diabetes and your hypertension. You should be concerned about respiratory problems. And so the population is becoming more and more informed through forums such as this, but also it's difficult to avoid now on social media the connection between poor oral health and general health. For example, we've done 2 surveys of seniors in Ontario in the past a year and a half to 2 years, and we've asked people, What causes a cavity? And I've been absolutely astounded about how many people know that bacteria causes a cavity. We've asked people about how important is your gum health to your moods? And at least half the respondents of these surveys are saying, we understand that if indeed I have sore and inflamed gums, I'm likely to have mood disorders. So more and more people are beginning to read and understand that the mouth is part of the body, and that indeed, when they go to the dentist, they're starting to ask questions about, okay, doc, what are you doing about my bacteria?
Very cool. And that's progress. Now, speaking of progress, I believe you have some demonstration, or you're working towards some demonstration projects around the country. Can you tell us a little bit about that?
We do. We've just finished a study with Toronto Public Health. Low-income seniors, these seniors have incomes below $20,000 a year. They have they have access to dental care through the public health system in Toronto. And what we did with Toronto Public Health is we took 25 of their highest risk patients. These are patients that had approximately 55 sites of bleeding in their mouth at the start of the plan. They were diabetic and hypertensive. They were on multiple medications. And so we treated them with this medication called Prevora. Over the course of 10 weeks, we gave them 4 applications. And at the end of 10 weeks, we reduced the amount of bleeding sites in their mouth by 65% at a very significant statistical value. The average length of appointment for these patients was 10 minutes, whereas a normal regular appointment for treating their gums would be an hour. So we reduced the amount of time, we had reduced the amount of stress that they went through, and we reduced significantly the amount of inflammation in their mouth. It's interesting. All those patients were what I would call potential dropouts in a study. They were not used to coming in for 4 appointments over that period of time. We were advised before we started the study that indeed there would be a number of them who wouldn't come back after the first appointment. And then by the end of the study, we found that there were no dropouts. Everybody came back. And we asked them at the end of the study, how important was this new model of oral health to you? 95 out of 100 said that it's very important to them. They found the treatment to be very acceptable. And interestingly enough, Michael, they said that they felt better. They had more energy after indeed we got on top of the inflammation in their mouth, which just makes sense. We're also about to complete what I call a breakthrough study. It's a small study. It was proposed by us by a very large hospital-based healthcare system in Hamilton, St. Joseph's. And they have an integrated care approach whereby people who are in St. Joe's Hospital for surgery or for rehab or whatever are tracked as they go home so that indeed the service can continue from the hospital to the home. What we have done is for those patients who are going home after stabilizing breathing problems, COPD, or congestive heart failure, or in a couple of cases, long-term cancers, we have trained the PSW or the nurse who delivers the home care service to spend 5 minutes putting on this medication on the teeth. And what we found is it was a dramatically popular program amongst the recipients. We reduced the amount of inflammation in the mouth by approximately 80 to 90%. We haven't got the final statistics, but it will be a dramatic reduction in the amount of inflammation. And again, the patients seem to be telling us they feel better. They have more energy. So that's the other study that we're doing. We have several lined up. We have a special needs program with autistic adults at McGill University that we're using. There will be 30 patients treated with Prevora there, non-invasively, without pain, quickly. So that study is about to start. We have a proposal into a very large near homeless charity in Hamilton, dealing with some of their addiction populations. If you have an addiction to methamphetamine, for example, you have dramatically poor oral health. You have stumps for teeth, and the inflammation in your mouth is just out of control. We can't get those people to go to the dentist. They have too many anxieties and phobias. So what we're doing is we're putting a hygienist in the facility, getting the staff of that facility to educate their caseload about having their teeth treated. And that study will start, we hope, sometime in the next 90 to 120 days. Again, a very vulnerable group that otherwise wouldn't get oral health care at all. We're hoping to work with primary care. We have a search out for a primary health care team, again, to add a hygienist to the team to deal with inflammation in the mouth. We have a search out for a wellness center to deal with people who are at home trying to recover. And we have hopefully a discussion ongoing with your organization at Blue Door in terms of transition housing. How can we get people that are in difficulty, have been in difficulty, trying to get their legs under their feet to get on top of their oral health as a way of improving their general health and their outlook on life? So those are what we're doing. We hope to, when doing these demonstration projects, we're hoping to show the National Dental Plan administered by Health Canada that indeed they need to reorient this National Dental Plan from fixing teeth to preserving teeth, to dealing with infections as opposed to chasing disease. And we're hoping to make that deputation sometime in the next 6 to 9 months, at which point in time, Prevora would be a covered expenditure, a covered item for the people that we've been talking about this morning, and that we can deliver, therefore, at no charge, effective, preventive, painless, non-invasive dental care through to the 1 in 3 Canadians that can't, won't, or don't go to the
Ross,
dentist.
I know that you mentioned a bit of a cost savings impact of Prevora, and you're doing the studies. Do you have any early findings that you can tease with the audience today on any cost savings there, or is it too early?
Yeah, well, we have been looking at one hygienist in Hamilton, Ontario, who is ahead of her time and certainly a tremendous researcher. She's had about 400 patients on Prevora for the past 10 years. And so the question comes up, how loyal are these patients to this new type of treatment? And what has been the effect on their oral health? And lastly, to your question, Emmy, what has been the cost savings? Well, I can tell you of these 400 odd patients, none of them have had a cavity and none of them have had sore inflamed gums over that period of time. The average age of those patients is probably 71 to 72. Some of them have lots of money, some of them have absolutely no money. So it's not a question of whether indeed you can afford this. It's a question of whether you want it. And lastly, we've looked at their cost pre and post Prevora. What we have found is the cost savings are greater than 50%. So these people are saving significant amounts of money over the course of their Prevora treatment plan. And those cost savings stem directly from the fact they don't have cavities and they don't have inflamed gums. But I also think it stems from a general improvement in their overall health. I'm going to give you a statistic which is provocative. In the U.S., there are these very large healthcare insurance companies that cover both medical services and dental services. One of them being Aetna. I'm sure you've heard of Aetna. And Aetna has gone into its claims experience over the past few years to determine what poor oral health means in terms of spending in the hospital visits and spending at the physicians and dental and drug plans. And what Aetna has published is a person with good oral health spends 17% less on the healthcare system than a patient with poor oral health. Now, if you're looking at a healthcare enterprise in Ontario, for example, of $65 billion, 17% reduction of $65 billion is a lot of money. And yet right now we don't have any way of reducing the poor oral health except by treating the infections. If you treat the cause of the problem as opposed to the consequence of the disease, you are going to drive cost savings dramatically upwards. So we believe that we can reduce the cost of dental care, to answer your question, by more than 50%.
That's awesome. And if you would just tell us, what are your hopes moving forward for Prevora and CHX?
Well, the hope is that we can work with organizations such as yours, that we can work with the diabetes associations, we can work with primary care, and work with pharmacists. We have a very good connection with a pharmacy currently who's very enthusiastic about making this service available to his high-risk patients when they come in for their medication refills. My hope is that this new technology, this new approach, will ripple through the formal medical care system, will ripple through the social service system, so that indeed an obvious problem for people, which is poor oral health, the most common of chronic diseases, I might add, that we can get on top of this chronic disease, we can reduce the cost and we can reduce the fear and anxiety associated with it, and we can get people feeling better. It's an enormous opportunity, Emmy. These diseases affect 2/3 of the adult population past midlife in Ontario. Now, that's a more prevalent condition than hypertension. That's far more prevalent than diabetes and cardiovascular disease. And now we have a treatment for it by treating the bacteria that are causing the problem. If you look at statistics about where Americans spend their money in terms of healthcare, the most expensive disease by far is poor oral health. It outrivals diabetes and cardiovascular disease significantly, as it does in Europe. So we have had this very large weight on the healthcare system called poor oral health. We have set up a system whereby we're chasing it as opposed to treating it. And with this new technology that we have been developing over the past 20 to 25 years, we now have an opportunity to treat this disease, treat the bacteria that are causing the disease, get on top of the disease, improve outcomes at much lower cost.
That's amazing. Ross Perry, president of CHX Technologies. If people want to see more of your work or connect, where can they go?
I'd suggest they visit our website for Prevora, which is www.prevora.com. That's Prevora.com. They can follow me on LinkedIn. I post regularly about oral health and its consequences. Follow me at Ross Perry on LinkedIn, or they can go to our corporate site, which is chxtechnologies.com.
This has been awesome. At Blue Door, we're focused on individualized solutions as we continue to work towards solving homelessness and creating housing solutions. And we know that has to be done with effective wraparound support. So this sounds like another great opportunity here, and we so appreciate you joining us. Thank you for joining us on the show today, Ross.
You're listening to On the Way Home with your host, Michael Braithwaite.